Thank you.
You're going to get a chance to do what we do in the office, which is hear people speak, and having been through it. Welcome. Thank you for again joining us as panelists. So I think that this is so valuable for everyone to hear that, and especially in different stages of where you are. Jerry, I think your pictures are so striking, and it's hard to look at you now and see what you look like in the middle of this whole process, and how good you look now. Congratulations. Yes. But do you? I mean, for you now, when you sit here, do you forget?
Yes.
Or because some of our patients have said that they look in the mirror and they're afraid of, am I still okay when they look in after it's all over? How has it been for you to go through this transformation?
Well, it's been a number of years, actually. This started in 2003, and the final surgery was in 2006. And to come here today, I had to literally go back through all of the photos and try to remember what it was like. That I've completely forgotten about all of the pain and how it completely took over my life. That having your eyes in different positions, seeing and over the progression of the disease, how it changes every day, that was the whole focus of my life. You get up in the morning and you've got dry eye and you have to take care of your eyes, you have to put your drops in, you take off for work, and I only had 5 miles to drive, but I had to cover one eye because if one eye was not covered, I would see the people walking across the street or walking on the other side of the street that looked like they were in front of the cars. So, and the symptoms changed over the period of the destruction of the disease, and then as it finally calmed down. So the pain was different. The adjustments to my life were different as it progressed and then eventually went into remission.
Yeah, you said 3 years.
3 years.
03 to 06. In our data, that's not unusual from the initial diagnosis to the end where we're able to finally have finished the changes. But imagine that you're able to sort of forget about 3 years of your life and push that away.
Yes.
My wife says that ability is why women have more than one child. So it's astonishing, the ability of human beings to be able to tolerate all this. Incredible. Barbara, you're an educator, and you've spent a career educating. Take a few minutes and educate us about what it's been like for you.
Well, I'm no spring chicken. I'm in my golden years when I expected to be able to do all the things that I was never able to do when I was working. I had a very demanding and full career, which I enjoyed. And then this appeared after I was retired and after I had a program of activities, volunteer activities and friends and travel that I was enjoying, and suddenly this happened and just intervened with the life that I had worked a long time to achieve. I have not had surgery. I had a bad time physically with Graves' disease, and the eye difficulty did not appear until after I had had some months, almost a year, I think, of just feeling rotten and being on medication that didn't seem to be helping. In time, it did have an effect. But I find now that this life that I have worked hard to achieve has been upset in many ways. Chiefly, driving has kept me at home, kept me from doing many things that I would like to do. I I can't even think about traveling because I have difficulty even walking. I have lost some of my depth perception, and I find that when I'm walking, even with a prism in my glasses, I sometimes don't see a curb. Took me a little experience in one bad fall to recognize that I need to be careful around curbs. And the fall was a lucky one. I just banged up my knees a little bit, but I wouldn't want to repeat that. So,
Well, I think this is such an important thing that you brought up. We live in Southern California here where this is taking place. It's very difficult to function here without being able to drive.
oh yes,
It's not New York where you put your hand up and get a cab.
yes.
And so that's a loss of independence.
Oh, absolutely, a loss of independence and a having to depend on other people, which is something that I don't much care about, but having to ask people to do some shopping for me or to take me to the market, having to ask people to drive me to a concert if I want to go. I'm very awkward at that kind of thing, and I don't enjoy it, and I would much prefer to be able to get myself where I want to go. So driving is a serious issue.
Meredy, your picture come up twice here so far, and you're one of those people who had significantly asymmetric disease, where one eye was much worse than the other, and you're in the midst of us trying to get you to where some of the other people here in the room are, where you can, on an average day, not have to think much about your eyes. I'm also curious if you wouldn't mind commenting on what it's like to talk to people and feel like they're judging you differently or thinking about you differently because of the striking change in your appearance.
Well, I'll be honest. When this first started.
I want to make sure that everybody can hear you.
Oh, hello. I withdrew. I completely. I completely imploded. I stayed home. I dropped friends. I stopped being social completely, and became completely dependent on people. The things that I truly enjoyed were very sight-driven. Art, drawing, cross-stitching, knitting. These are all things. Reading, I was a voracious reader before this happened, and I couldn't read at all when it did happen. But now, I have eye movement. I can read. I am 1,000% better than I was. So I'm very happy with what's progressed to here. But in terms of other people, I still haven't quite stepped out into the public again yet. I'm still shy, hesitant, whatever.
Well, it's funny because in the office when you and I chat, I don't think of you as shy or hesitant. You're a very outgoing, personable woman, and yet you're changing in public.
I'm a complete different person in public. It was very hard to get here today.
So, Jerry, did you find that while you went through this journey, that people treated you differently or looked at you and weren't listening to you but staring at you instead? Or did it change the way you felt you were being perceived?
For those people who I didn't know, and for children, yes, it was, I got a different reaction from them. I was fortunate. I had a family of friends and relatives who supported me through this, including all the people at Chiley Eye. And I think that keeping a positive attitude towards the whole process helped get me through it. And I walk with a group of friends, and they would push me to the side when I would get off close to that curb over there, to keep me from falling off the curb. So it became a group affair of, watching out for Jerry.
Well, that's part of the reason we think it's so important to have somebody with you at these appointments or listening to these kinds of conversations so your support group understands what you're going through.
Yes, I agree.
For everybody, for the whole panel, You come into here, all of you have been our patients. We think it helps talking to all of us and some of the conversation that we have and the ongoing discussions, but do you think it helps? I mean, is there something that you'd like to see more of or less of? We're open. I mean, you know, we're happy to take your input. Is it good to have the whole team walk in together?
Absolutely.
Yeah.
I think it makes a big difference. I started my going to a neuro-ophthalmologist first that was recommended to me by my eye doctor, who diagnosed this disease before I could come to Shiley Eye. And this is a top-notch neuro-ophthalmologist in North County who said there is no other better place to go than Shiley Eye. And although he had to give me up as a patient, he highly recommended this because of the fact that you have the 3 doctors all together. It makes such a difference. Plus, you get to come on a Thursday once a month, and all the other thyroid patients are in the office at the same time, and we can exchange our experience. And I have had the opportunity to speak to several thyroid eye patients as they're going through it. I've completed my transformation, but what a difference it makes for them to be able to talk to somebody that has already been through it, to help them understand that there's an end to all of this, and you will look better, and it will change your life when you're back together again. You just need to go through it.
Barbara, you've been in charge of a university. I mean, you're an educator, and I hesitate to put myself at your at your mercy. How you know what else needs to be done educationally, or what else can we do, or we going okay?
You know, finding Shiley was the best thing that happened to me. And one of the things I want to say about you 3 guys in the office is that you're fun.
Yes.
That it's clear that you enjoy one another and that you work well together. And this inspires such confidence. I'm skeptical about doctors, but I'm not scared by you guys.
I'm not sure what to say to that.
At least you're not scared of Dr. Granite, right?
Yeah, I mean, I'm wearing Mickey Mouse socks. It's hard to be scared of me. So it's. Meredy, you know, when this first started, were you diagnosed right away?
No. Actually, I did not have the typical pain that caused everybody to go see a doctor. What happened was I thought my glasses were crooked, and I kept trying to fix them, and then they were sitting wrong. And it wasn't until I looked in the mirror and I saw them cockeyed, so I went to see an optometrist who told me that I had a mini stroke and I should see a neurologist.
I'm going to ask you to pause for a second. How many
Yeah.
people in the audience were diagnosed with something else before eventually they figured out that it was Graves' disease? Okay, so it's a good chunk of the people here in the room. Sorry, go ahead. It's a very common scenario.
I saw 5 doctors before I got, 5 different doctors before I got to Shiley, before I finally got to the thyroid clinic, and it was a relief.
While I was driving in today, I was flipping channels on the radio, and as it's not uncommon on a Saturday morning, there was some talk show pitching something, and it was an ointment to get rid of bags under your eyes. And I'm listening to that going, I wonder if how many of those people have Graves' disease and they're, you know, trying for this kind of thing. But it's not uncommon as you get older to have some of the changes. I'm getting them as I lose my hair. And so they can go together. Allergies get diagnosed as Graves' disease. Bags under the eye. Allergies get diagnosed instead of Graves' disease. Bags under the eyes just as aging. A stroke. These are very common things that we hear. How many people in this room were told nothing could be done before you got to us? So got several people who raised their hand that way too. Well, is there anything else you guys would like to add that you think is valuable for everyone to hear? Because we are going to swap out and bring another group of patients up to share with us as well before we move on. I wanted to give you guys a chance to add anything else.
I think keeping us informed of the progress of knowing, for example, that the eye has to stabilize before anything can be done understanding that progress is very important, and I think you should not lose sight of that.
I'll tell you what helped me the most. Absolutely. My confidence was through the floor. I had no confidence. But the first time I cracked a joke and you smiled, that was great.
Well, you know, thank you. But we are deadly serious about trying to make sure that everyone gets the best care. But there's an old saying, you know, if you don't laugh, you're going to cry. And so we want to smile and stay upbeat while we're working as hard as we can to make a difference for people. And so thank you for noticing. I'm really sure it does. So let's give everyone a big round of applause, and thank you so much for sharing with us.
Thank you to all our distinguished panelists, and we really appreciate sharing a bit of your lives with us. We're going to switch gears now and ask the second panel to come up, Joyce, Stephanie, and Barbara R.
So, welcome, and thank you again for sharing. Once again, we have people in different stages of the disease, at different components of what's going on. You heard our previous three panelists go through this, and so we'd like to give you each a moment to. We'll go through one at a time to talk about how your life has changed, how surgery may have made a difference, and what any advice you'd give to somebody who's going through this process as well. So we'll start with Joyce.
I was diagnosed with the Graves' disease in 2000. And although I had developed a goiter, went to the emergency room. They just looked at me and the doctor said, I'm thinking it was maybe an intern. He said, well, if I didn't know better, I'd think you had a goiter. Go back and see your primary physician. So I went around and around for a while before all of a sudden everything just kind of, I was shaking and almost passed out in a staff meeting one day, and I said, I think I better go to the doctor, and they diagnosed thyroid disease. And then they radiated my thyroid, and then my eyes bulged out, and so I went to a doctor that I was told was an eye surgeon. So happy that he handed me some material about Shiley Eye Center, because he said, oh yes, I've done this operation. So I just thought, I'm going to ask his receptionist how many times he did this operation in the last year. She couldn't find one time. Made an appointment to come here for a second opinion, changed my insurance, had to wait a whole year before I could come back. Met Dr. Kikawa, met Dr. Granite, and my life has changed considerably since I had the operation, and I'm just so thankful and so happy that I found Shiley Eye Center and these doctors. And I can just reiterate what everybody on the first panel said.
Do you feel like yourself again?
I do pretty much feel like myself. I still look in the mirror and I still think, I wonder what I would have looked like if this hadn't ever have happened, but I am pretty darn close to looking how I used to look. My confidence is coming back. I didn't realize it had gone away. I plugged on, I trooped on, for that time. I was a high school teacher. I taught theater and dance. And, I'd look at myself in the morning and I looked pretty awful, but I didn't have to look at myself throughout the day. People were very kind to me. They didn't really react, with horror in their faces. My students sometimes, one little boy, they're in high school, but he said, I'm afraid of you and your big blue eyes. And, there's just a couple of things, but my confidence has really come back. And as Dr. Kikawa said, I am a performer too, and I'm happily performing again and feeling that I look normal when I'm on stage.
One of the striking things we've heard from our patients is that going from being complimented for what beautiful eyes they have to having people stare at their eyes and in concern of what's going on with your eyes, and that's a big change for them. Barbara, would you share with us what your journey has been like?
on? Is it on? Okay.
It's on.
So, kind of backward from getting to Shiley, I was seeing other doctors, pretty much told, you're not as bad as some others. And I remember thinking, well,
Does that make anyone ever feel better? It's not as bad as it could be.
I was sort of thinking, well, this is as bad as I've ever been, and it's pretty devastating. And so, one thing that really, really helped me was I don't know how I lucked on it. It's because I work in schools and I do a lot of research, and I went online and I was lucky to find the Graves and Thyroid Foundation, and the folks with the forum were an amazing support for me, because I thought there were times when I would just open up that forum in the middle of the night and just read things and go, okay, I'm going to be okay. There's people that are further along in this process. But it was pretty hard that every 3 months go in, you need to wait another 3 months. You're not as bad as any other people are. And so I went to the Graves conference about a little bit ago in October, and you guys were talking. And my husband and I were there, and I was in a bad spot. And I mean, active, watery, just could have cried on a moment's notice. And you guys were talking, and I looked at my husband and I said, that's what I want. And he said, okay, we're going to do it. And so I had to do similar to what Joyce was saying. I had to make some adjustments to insurance, but I said to myself, I'm an educator, so I had the summer off. I said, I'm coming down. Oh, by the way, I don't live in this area. I live up north in San Francisco Bay Area. So I said, I'm going to take a trip, and I'm going to just go meet these guys. And I took my sister with me, who's a physician, and she said, you need to just go here. And so at that point, I just found the arrangements, and I've never been happier than I feel the confidence, and I think that's the thing is I wasn't confident that I was going to get the care I needed. And to do this type of thing, you have to feel that you're getting the very best, and I felt that. And so that's the story you're getting here. And then just in October, I had the orbital decompression, both eyes, because I'm one of those that is coming down here. So we did both eyes, 3 walls. I think I was 29 millimeters, so it was I was out there pretty far. And so I'm going to have, I guess you'd call me a work in progress, because I go in on the 14th, on the 10th for the lids. And I remember going in to see you guys, and I had my binder. And I think you guys probably remember it. You guys came in, and the whole team comes in, and they say, what do you do for a living? And it was just like that lightened the load, similar to what I think you were saying. It's like, oh, have I over-prepared? But it was just fun. It was a fun thing, and I've never looked back. It's just been the best.
Oh, thank you for sharing that. I will tell you that we all like what we do, and my wife thinks I'm a little bit of a busybody because I'm always interested in everybody's lives and what's going on, and I want to know. And I mean, Stephanie, you looked fabulous in your wedding picture, right? and to go from that to the way we saw the change, it's hard. It's hard to do, and I think it's hard at any age, but not long after your wedding to have those changes. So if you talk a little bit about your journey and share with us.
Of course. It wasn't long after I got married that I was diagnosed with the Graves' disease, and soon after that, I went to visit my mother, and she tells me as politely as a mother can, there's something wrong with your eyes, you look terrible. It's like, thanks, Mom. You couldn't have lied to me, No, she told me I looked terrible, and I was like, I didn't get what she was talking about. And a few days later, I went and had my hair done, and the hairdresser does all the angles to show you what they did. And I noticed in the mirror that my mother was right. There was something wrong with my eyes. So I went to my endocrinologist, and they put me on high doses of steroids, to a point where I had to go back weekly to make sure I wasn't suffering from what he called roid rage. And he'd ask me, have you had any incidents this week? What am I, the Hulk? And so he suggested I go see a surgeon, and it wasn't Dr. Kakawa at the time. It was someone else, and he walked in and he said, I can't tell that there's anything wrong with you. What I can do is I can put you on a steroid drip for once a week, every week. I told him I'm already on steroids and being checked for roid rage. What more can we do? And he said, well, I can't see anything. And he sent me away. I went back to my endocrinologist crying. I'm a crier. I'm the crier. And they sent me to Dr. Kakawa. They took a picture of my driver's license, and Dr. Kakawa came in and said, I can fix you. Perfect. And because I looked good at my wedding, I wanted to look good again.
So I'm going to interrupt for a second. Did the other doctor look at a picture of what you look like before?
No, he said I wouldn't be able to tell.
Yeah, see, everybody who comes here, we always ask you for old pictures because we've never met you before. And we need to know what you know, which is what you used to look like.
Right.
And that wedding picture to what you looked like is striking. I think
Yes.
anybody would be able to spot the difference.
Yes. He didn't. I pulled out my driver's license. I tried to show him. He said, I can't tell. I said, okay. Came to Dr. Kakawa. He said I could fix you. I cried some more, and he fixed me. So, and of course, with the help of Dr. Granite, my eyes are straight. I can see, and I'm much, much happier. I've stopped losing my hair. I lost my hair for a little bit. Much better.
Can you tell me how to not lose my hair? So one of the things that we've talked about is the support that you get from the people around you. But I'm wondering if you could talk about the impact of the disease on the people around you, not just the support, how it affects your family, your friends, your relatives, because they may be driving you around, they may be having to deal with your roid rage or the disease rage or the changes and the depression that you're having to deal with. How did that impact the people around you?
I was just my husband and myself, and he was just an incredible support. He looked at me, and to my mind, I didn't look any different in his eyes than I ever had. So I didn't have a big support system, and I kept driving, sometimes like this, of course. I kept driving, and I kept, I had to go to work. I kept going to work. So unlike some other people who might have had a large family for support, but I didn't. I just still felt like I was me, and I just kept plowing through. So
How wonderful to have someone who could still see you and
That's how
the
I
woman
felt,
that he loved and married. I mean, that's precious.
Yeah.
Did it affect your families or the people around you?
I think it must have, but like yours, you just support. I remember even during the surgery, you have to have 20 minutes ice on and off, and in the hospital, my husband was there putting the packs on, 20 minutes, and But yeah, I also feel you're beautiful, and it just would be like, I am not. I am freaky looking, and the kids are calling me creepy, and in school and stuff. So it was tough, but
Stephanie,
always support.
We've heard the difference between a spouse and a mother. The mother looking at you and telling you right off the bat, and the spouses who. Do you think how is it for you, newly married?
I'd ask my husband if he'd noticed, and lying or telling the truth, I don't know. He would tell me that he didn't notice anything different, other than the fact of the mood swings. He didn't notice. But when I had the surgery done, he took the time off work. He'd come in, it's time for your medicine now, and he'd put the drops in, and he'd change my ice, and he took care of me.
And to wrap up, I'd like to ask each of you, what advice would you give to someone who's in the midst of all this right now?
In the midst of it, well, of course, keep going, but anybody who is even thinking about having the surgery, I would just tell them, walk, don't run, to the Shiley Eye Center and to Dr. Kakawa and Dr. Granite and Dr. Korn. It's the best thing that ever happened to me, really, after I got the disease. So don't, and I was a person, I always prided myself on being a good patient, and I was terrified. I was really terrified of having the surgery. I was upset after I had the surgery. I wasn't a very good patient, I didn't think. But that was the first surgery. After the next two, hey, piece of cake. All right, but yeah, my advice would be, the outcome is wonderful, and the people here are so supportive and so positive, and so calming, that it's going to be okay and everything's going to turn out. So my advice would be do it, do it, do it.
Barbara, Stephanie?
Well, you have to feel that confidence in order to go through with that, and you just have to know that this is, going to help you, and if you don't feel that confidence, you need to come here. But you need to get the team that comes together. I know in my situation, before I said, after I'd gone and seen the team, I went back to my providers and I said, I like a team. And they said, we'll take that as a complaint. And I said, well, okay. And then they came back and said, you do have a team. It's this person and this person. And I said, but a team works together. So I would definitely advise people to work with a team. It makes a difference.
If I came across anybody with it, I actually haven't met anyone else with an eye problem other than here. I mean, everyone else looked at me like, we don't know what you're talking about. But if I came across them, I would tell them, absolutely come see you guys here. I would suggest here, if they cannot get here, go somewhere that can do something for you. Because living depressed and locked away is not a way to live. It's just not. And when you get your life back, you feel so much better.
Thank you so much for sharing your journeys with us. Let's give them all applause. And I'll add, once again, I learned something. I learned that as a spouse, you need to be relentlessly positive with your spouse.
Thank you so much to our panelists. I know it's asking a lot to come up here and share your lives with us, but we're so appreciative that you've given us that insight. And we're going to switch gears now. For the last 10 or 15 minutes, we're going to do a physician panel. So many of the questions have come in through the Graves' Disease and Thyroid Foundation website. Kimberly posted, some possibility of having questions raised at this conference. So I'm going to moderate this portion, and I'm going to draw from some of the questions that were asked, and I'll be asking Dr. Korn and Dr. Granite. We've seen a lot of people that have had good results with surgery. Can this disease ever come back after it's treated?
Yeah, if you read the textbooks, no, but in actuality, yes. And it's one of the values of having been here for 20 years, watching people that we've seen over time. And when somebody makes an appointment that we haven't seen in 5 or 8 years, when we see their name on our list, we get nervous because we hope that doesn't mean that there's been a recurrence. Most of the time, the curve that you saw holds true, that most people, when you wait, they stabilize, we're able to intervene and make a difference, and they're stable and they stay stable. But the human body doesn't always work that way, and sometimes over time, we see people many years later have some recurrences. That doesn't mean that it starts all over again. It doesn't mean that the proptosis gets horribly bad again or the double vision gets over again. But there are some people, and it's again a small percent, where we have to start dealing with the disease getting active again. But many of them, it turns out, are still smoking. And so once again, we say, if you are smoking, stop smoking. I have never spoken to a physician in any field, in any aspect of medicine that says, oh yeah, smoking's good. It's just, there's nothing good about it.
Yeah, just to echo Dr. Grant, I mean, fortunately it is uncommon. I'd say less than 5% of our patients have a recurrence, and this can happen at any point, a month, a year, 10 years, 20 years down the road. And when it happens again, if you've been through the process, we just reassure you that we have to go through that same process. We've got to wait again. We have to wait till the disease quiets down, and then once it does, we do everything we can to give you more treatments to get you back where it was. I think the fortunate thing is that oftentimes it's not as bad as the initial disease was to begin with. So you may have little flare-ups here and there, but until we really get a good grasp on what the cause of this, and why the immune system is activating, we still can't really offer a definitive way to shut down the immune system.
Another question, Dr. Granite, can you comment on the relationship of radioactive iodine and Graves' eye disease?
Yeah, it's sort of fascinating. Some people get radioactive iodine to ablate their thyroid, and it turns out that there's a statistical increase in the worsening of those who had eye disease to start with. Statistically, they get worse afterwards. And it turns out that if you give steroids at and around the time of the use of radioactive iodine, you can blunt that effect. You can't make it zero, but statistically less people will get worsening of their eye disease. The way we think about that is that it's an immune-related disease. When you use radioactive iodine, you kill the thyroid cells because the radioactive iodine is collected in the thyroid, and then those cells die and spill their contents, and they rev up the immune system. We think that's what happens. That's our best sort of logical, common sense explanation for it. So by using steroids, you hope to blunt that. And there are some people who choose to have thyroidectomy instead of radioactive iodine because they're concerned about this. And we don't think that's such a bad idea in the hands of a great thyroid surgeon, which isn't always available to everyone all across the country. And you may have to search for somebody like that. And there may be some advantages to thyroidectomy versus radioactive iodine. And we're still trying to understand that, and we're trying to look at some data to figure that out. I can tell you that over the years, we started using steroids at around the time of surgery that we do to try and blunt any possibility that the stuff that we do, whether it's decompression, lid surgery, or muscle surgery, to make sure that we weren't doing the same thing, activating the disease in any way by the surgery we did. So we tried to learn from that and apply it to what we use here, paying attention to this. And in fact, it was Dr. Kikawa who said that to me, and I started using the steroids after that. I thought it made a lot of sense because sometimes people looked a little bit more active right after our surgeries. So we're still trying to understand that, but we want to think carefully and make sure we make educated decisions when we use things like radioactive iodine or thyroidectomy, and know what the risks are and try and take care of them. And that's where our interaction with the endocrinologist will often help as well.
Dr. Korn, can you comment on the persistent red eye that occurs after the active phase of disease and any dryness that may be ongoing even after treatment?
Sure. One of the most common things that, patients who haven't been diagnosed with thyroid eye disease who see their eye care doctors are given the diagnosis of allergies, infections, and I'm sure many of you have seen your eye care professionals and been given steroid drops, antibiotics, antihistamines, and so forth. And it works for a small amount of time, but then your symptoms never quite get better. And oftentimes it takes a lot of persistence on your part, on the behest of your endocrinologist, for you to come to see an ophthalmologist who specializes in thyroid eye disease, and that diagnosis is finally made. So we often see these conditions that are misdiagnoses. Now, as you know, the disease goes through different phases. The active phase, when your eyes are really red, irritated, prominent, to when the disease quiets down, there's less redness, but still there's that underlying pressure feeling that you have in your eyes, the double vision. That's when we intervene. We try not to intervene in the early stages when the disease is still active, but we try to do the best we can for our patients in the meantime. Drops to lubricate the eyes. We like to minimize the use of steroids because if you've used steroids during the active phase of the disease, it makes you feel better. It cuts your symptoms down, right? But the side effects are enormous. We heard about the steroid rage that occurred earlier here. That happens. And when we tell patients that maybe you should stop your steroids, the spouse in the back of the room is saying, yes, thank you, because it really changes the way you feel, your thought process. I mean, it really drives you, into a rage. So we try to do our best to hold your hands, support you as best as you can until the disease quiets down, and then we intervene.
One of the things that both Dr. Cow and Dr. Korn have taught me over the years is that you don't water a lawn after it turns brown. It's too late. And this is Dr. Kakao's analogy. You water the lawn while it's green to keep it moist and active. So at night, you moisten the eye so you don't wake up with a dry eye and then spend all day trying to put water into a lawn that's already turned brown. You want to stay moist the whole time. And I'm going to turn the tables, Don. Would you comment on the use of plugs even during the active phase or while people are irritated?
Yes, so what Dr. Grant's referring to are punctal plugs, and I think for some patients they are helpful because what we're able to do is put a plug into the tear drainage system, and it allows more moisture around the eye. There is one controversial aspect. Some physicians and some researchers have shown that the tear consistency changes in thyroid eye disease. So that may be a little more irritating to the eye, and some of the irritation that you get just may be from a different tear composition. So we look at each patient individually. It may help some, and it actually in some cases might worsen just because of that issue that I talked about.
In general, we also try to advocate the use of preservative-free artificial tears. Many of you have also found that, we tell you to use drops, but what's the reaction when you put it in your eye? It burns when you put it in your eye. And oftentimes it's because what we've said earlier, the grass is already dead and it's burned. So you've put it too late. So do the best you can to be proactive and keep your eyes moist so that it doesn't burn so much when you put them in your eye.
Last question. There are clinical trials going on about medications that are under investigation for stopping this disease or treating it. Can either of you comment on clinical trials that are going on?
Sure. So if you go to the Graves' Disease Foundation website, there's a link that you can go visit. I think it's the Blue River Study Group. What this group is doing is they're using, extending what we call translational research, using some of the studies that were obtained in laboratories showing that a particular molecule, insulin-like growth factor 1, may have a pathogenesis in the disease process. And what they're doing is they're using this compound to block this compound in patients to see if there's an effect. Now, we were actually approached early on to participate in this study. And as you know, with any treatment, whether it's steroid, surgery, even drops in your eyes, there are potential side effects. So we wanted to really wait till some of the data came out before we decided to enroll in this study. But if you have any questions or interested, please go to the website. They can give you a lot of important information about this new trial that is going forward.
Great. Dr. Granite, any parting comments?
We've been sitting here for an hour and a half, and it seems like a long time, and there's still so much more to talk about, and there's so many more things that we could say. It's hard to, even in an hour and a half, to compress the information that's available about thyroid eye disease, or what we've learned and what we've taught other doctors along the way, and to share what you've learned with us. I think, again, I continue to learn. I learn about the bravery of our patients to be able to sit in front of a crowd and have their pictures shown and talk about their experience, and whether it's roid rage or some of the other things that we heard. That's not easy for people to get up and share. I think that's hard. And, to know that there are others going through this process and that there is help is fabulous. We would be thrilled to be obsolete. We would be thrilled that there's a pill that we could give you that would just stop the immune system from ever having this happen. We would be thrilled to identify the genes that separate out these diseases. And I think that all of us think that thyroid eye disease is not really just one disease, that there are subtypes A, B, C, D, E, F, G, and as we know more about it, we'll be able to identify it, why some people's fat gets worse or some people's muscle gets worse. And we need to continue to do the hard work of understanding that. And so there's a parallel pathway going on. The hard work of the research when we all put our academic hats on. How do we learn more? How do we get better at this? What can we do to offer to change and improve? How can we make all the things better that we do today and what we learn from you? And then we have this pathway of what can we do right now to help you? And I look at it as, the airplane has to take off today because you need to fly across the country today. But we hope 5 years from now that the airline industry has better, safer planes. And that's kind of what we're doing in parallel, is that we want to get better and better and better at this. We're not satisfied. None of us are, no matter how good you come out. We'd like to shorten that course of the disease. We'd like to make a change. But in the meantime, we're thrilled that we have something that we can offer, and that there is so much hope that we can get most people back to the point where they can resume their lives and have a functional life and be able to live each day not thinking about their eyes, but instead having the joy that life brings.
Well, thank you. Thank you all for this very informative session, and we hope to have more of these in the future. We want to thank particularly our patients who've participated, shared their intimate details of their lives and their experience. We want to thank the Graves' Disease and Thyroid Foundation, the Flynns for their support, Kimberly Doris for organizing everything, and our staff, Karen Anisco and her staff, and John Serta for the excellent audiovisual support. So this concludes the seminar. We're going to take a break, and then we will actually reconvene here for an informal question and answer period, because I know many of you have questions probably based on what was discussed this morning. So thank you very much.